This presentation will present an overview of objectives related to quality and safety education for nurses, known as QSIN. It will also provide an overview of Assessment Technologies Institutes, known as ATI, and discuss accreditation for organizations through the Commission on Collegiate Nursing accreditation. It's an overview of a PowerPoint presentation presented to National American University. QSIN's purpose is to prepare students to improve quality and safety in their specialized area of nursing. They do this by utilizing 3 different standards. The first is knowledge, then skills, and attitudes. It is commonly referred to as KSAs. Competencies are part of QSIN's organization. They have 6 separate competencies, and they utilize each with a knowledge, skills, and attitude portion within the competency. The first competency is patient-centered care, and under knowledge, an example would be strategies for the patients to empower them. Under skills, it would be to remove barriers and recognize that there are boundaries. As well as under attitudes, you want to value the partnership that the nurse has with patients and recognize that various backgrounds are provided within our patient population and to be cognitive of those differences. The second competency is teamwork and collaboration. Under knowledge, you want to recognize that there is a need for collaborative care and that there are various communication styles. Under skills, you want to function within your own scope of practice. You want to clarify your roles and ask for help when necessary. Under attitudes, you want to value teamwork, use good communication, and contribute towards conflict resolution. The third competency is evidence-based practice, and under knowledge, an example would be to include components of research into evidence into your patient care. You want to integrate new evidence into clinical practice as part of your skills presentation, consulting before deviating from any established practices. Under attitude, you want to appreciate the value of professional journals and strive for continuous improvement. The fourth competency is quality improvement. Under knowledge, you would describe strategies to incorporate learned processes to increase outcomes. Under skills, you would use tools to incorporate new care standards and then evaluate the effectiveness of that change. And under attitudes, you want to value the use of continuous quality improvement as part of good patient care. The fifth competency is safety. And under knowledge, you want to acknowledge that there is room for human error. You want to reduce your reliance on memory. And you want to be able to discuss different strategies in order to make patient care safer. Under skills, you want to demonstrate effective use of technology, support safety, and then communicate any concerns. Under attitude, you want to value the role of preventing errors, and you want to monitor not only your performance, but the performance of your team members to contribute to safety. The sixth and final competency is informatics. Under knowledge, you want to explain how technology is available and how it is used to be part of safe patient care. Under skills, you want to seek out technology. You want to understand its use and be able to use electronic health records for documentation. Under attitudes, you need to appreciate the necessity for lifelong living, value technology, and the nurse's involvement in that technology. In addition to student resources, QSIN also will provide education for faculty to help them develop their skills as nurse educators and promote different ways of teaching. The Assessment Technologies Institute, known as ATI, is an e-learning program to help improve student outcomes and program outcomes. For students, they will provide simulations for NCLEX testing, and they also will provide information related to pharmacology. They provide a simulation scenario called Real Life, where a student goes through a scenario, has a choice of interventions, and then based on the choice of their intervention, they can see what the outcome is to decide if they've chosen the correct intervention for that patient scenario. They can use that information to help increase their skills. For educators, we have an obligation to give input into the teaching scenarios. We want to see how those test results of students are measuring up against and can evaluate the use of our teaching skills to evaluate that students are learning what they're supposed to be learning. And then the information provided by the test results can provide documentation necessary for accreditation. Accreditation is provided, one organization that provides it is the Commission on Collegiate Nursing Education, commonly known as CCNE. They provide accreditation to organizations that have a baccalaureate or doctoral program. They also will provide accreditation to distance or online learning programs. There are several steps to accreditation. The first step is what's referred to as a self-study. So basically, the facility that's wanting to be accredited will contact CCNE. They'll receive a packet. Part of that packet is the self-study. The facility will fill out the information related to how they think they're already contributing or meeting the accreditation standards. That will go back to CCNE. Once that's received, CCNE will send out a site visit for the facility, and having 1, 2, maybe 3 accreditors come out to the organization. They'll review the self-study and compare it to what is already in practice at that facility. Just measuring against what the organization thinks they're doing correctly, and then matching it against what the standards are for the accreditation process. CCNE is a little bit different than some accreditation organizations in that at the time of the site visit, if there are discrepancies between what the organization thinks they're doing and the accreditation need, they will provide the time for the facility to make those small changes to bring that up to standard. Once the site visit is over, the CCNE team goes back to headquarters, they review everything, they send their results to the board of CCNE, and then accreditation is either granted or denied. If accreditation is received, it is to be reaccredited at a time period of every 10 years with the possibility of periodic reviews. Thank you for your attention.